What's up, guys? It's Twisty and the Spiz, and I've been featuring chiropractors across the country that are doing bigger, bolder, more magical things, helping make more impact in their community by doing it different. What sets them apart from other chiropractors. And one of those ones that inspires me daily is Dr. John's work up in Rochester, New York, who might come across a little bit like House every now and then, if you remember that TV show, because he's got some chips on his shoulders, which inspires me and it should inspire you to do things differently and not chase symptoms. So that's the first thing, Dr. John. Before we get into you, I want to talk about that chip on your shoulder and why, chasing symptoms ticks you off so much.
I mean, personally, for me, the hardest part, I mean, it's going to get emotional right away, is like my brother,
Yeah.
you know, chasing symptoms. I mean, granted, I'll say it right now, like he was dealt a bad hand with the diagnosis he had of a stage 4 cancer. That, there's lots of things we can go down the rabbit hole and say how we got there with negligence and things, but that's not what we're here for. So you watch the system take somebody who, was seemingly healthy, and it was just one test with this one person, or the person was not looked at a whole to start. That's how he ended up where he ended up. And then when we
Yeah.
found out about it, he's sitting in a situation of what do I do? And it's just treatment after treatment that are really the cancer treatment's made to just decimate everything. So if it's going to decimate everything, what are you doing to build it up on the other side? I also was then diagnosed 7 months later and I had cancer. And I went all in on the nutrition, but I still had the conventional medicine approach because it was integrated. But for my brother, someone who didn't have the education I had, even though I was there, you have to support the person in the journey they want to take. It's not easy. So supporting his journey and that those medicines, watching them, treat, not care for, it really watched him go down the rabbit hole. So it's chasing of symptoms instead of building up the body. I mean, it just came very evident watching it with him, and it became more evident when I had to go through it. So, I just dove all in. I already had been into some functional medicine studies, and I was already doing, really good chiropractic work where I'm incorporating upper cervical with some other structural techniques so that you can
Yeah.
see some lasting changes. So when you have this stuff at your disposal, you feel like you got to put something together and start, talking about chasing health as opposed to fighting symptoms. I think wars just lead to more wars. So, like, why don't we just
Mm.
start caring for our body instead of fighting it?
Before I have a question to dive into who you are and your story, but before that, I think something the audience should know is post-COVID, and I think this ticks us all off in our space right now, as you see post-COVID, the allopathic world's now going preventative. They're using the language. Doesn't mean they're actually applying it, but from a branding and marketing thing, it pisses me off so much because they're now going, oh, it's preventative health and fun, all this stuff. But it's BS. So be aware out there, right? For what's
Well, I mean,
real.
all of that preventative stuff is really, it's not preventative because you're looking to see if something's already there.
Yeah.
What are we doing to see if it's going to grow? That's where I live, right? Like when I
Yeah.
went through the cancer, it was like, I wanted to know if my body was going to grow more weeds, not if they're there and how many are there. I want to know what my soil is doing. I want to know how fertile I am, right? So
Yeah.
if I know this, then I'm going to grow better cells, then I have a better chance of not continuing to grow cancer. Do you see what
So
I'm saying? So, but what they're going to
absolutely.
do is they chase these 10 labs that say, how bad is your cancer? They would not run the 20 or 30 labs I wanted to know, will my body grow more of it? Because they didn't understand them and didn't want to be responsible for them because that's what the hospital told them to do. So it's a commodity. You're bought and traded. It's terrible. Like
Uh,
the system is messed up. So like their preventative is not preventative
yeah.
in the long talk.
We have Dr. John here, and so give us your background, brother.
I'm born and raised in Rochester, New York, upstate. Been here most of my life, and I chiropractic fell into my lap by a couple friends of mine that I ended up staying with, going between my senior year and my super senior year of college. It was the best thing that ever happened to me, and I believe that everything has been put in front of me. Fate, God.
Yeah.
I mean, it's kind of an emotional thing, but the traumatic brain injury brought me to upper cervical.
Yep.
The cancer brought me to functional medicine, and you got to put it together and share it with your people.
You're doing big things and helping the Rochester community. and you kind of shed some big shining flashlight already on it, but let's shine some more flashlights on some of the BS that really ticks you off that you think that the community should know when it comes to healthcare versus sick care.
Well, I mean, the biggest thing is that nobody is running labs that I wouldn't say nobody. Not many people are running labs that are going to tell you what your body is capable of doing, where it's going, the trajectory of the health. It's all looking to see if we've already found something that's there. Like we don't need to know if it's already there, it's already there. It's good to know, then it's good to know how bad it is. I'm not saying these tests aren't valuable or that you shouldn't run them, but there's other tests that should go with it. Blood
Yeah.
tests. How many people have run their DNA to know, when I ran my DNA, I thought about the fact that I'm wearing these right now because I see that in my DNA, I don't process certain vitamins that are going to help my eyes. If I knew that when I was 10 and my parents wanted to feed me correctly, if I knew that when I was 20 and make those decisions for myself, would I wear glasses now at 40? These are the
Yep.
questions I ask. So why not chase what our body needs if we have our DNA profile? Then we get these blood labs. But I mean, the most basic thing for me is what are we doing to make sure our nervous system is working correctly?
Yep.
If it's the power that runs the whole body, what are we doing for that? So for me, chiropractic is a great modality for that. I think it's more of a caring art. It's not a treatment. I don't like to use the word treatment. So if we can do these things, like I never understood this. We need to get our teeth cleaned. Now, great, oral health is I do too. Oral health is great for you, but we can't get around the idea that we need to have our spine
Yeah.
checked and our nervous system working. So whether you have a symptom here or a symptom there, we're chasing things. So I think the biggest thing that we need to understand is it's really not healthcare. We're looking for sickness. When can we turn around and start looking for health? I mean, there's a book, I forget when I got it. It was during the pandemic, and it was that U squared, and that it's
Yep.
opened with a fly bouncing itself off against a wall, or a window, and it couldn't get out of the room. And if it just turned around and went the other way and went out the open door, right? So it's the same thing we're doing with healthcare right now, but it's because our bodies are bought and sold. I mean, it's the biggest industry. I mean, where I live, the biggest producer is a hospital, right? I mean, so these are the things we're talking about. We need to understand that this is
It's a scary
these
system because the
preventative tests
biggest
are not
employers,
preventative,
yes. Yeah, the biggest
you know?
employer in every city is the hospitals, dude. It's scary as hell.
So it's crazy. It's just it's
So
very
you have people
sad.
bought in. You come from a place of wholeness and holistic, and so let me ask you, what are some things that your people in your community should be doing as part of at home for their health care? What are some things they should be doing?
Well, I'll start with my personal issue right now. It's sleep. I've always
Yeah.
battled it. I was talking about this last night with somebody, and I said, "Listen, I think the last time I slept well was undergrad." So and we're talking a long time ago, right? And I don't know if that was good sleep because there was partying involved, but that's a whole nother story, right? So, but sleep, good sleep,
Yeah.
timely sleep, on a schedule sleep. I mean, these are things that are really going to help you to integrate any other thing you're trying to do for your health. If you don't
Yep.
have sleep, any other thing you're going to do is going to be less effective.
Yep.
So that is number one. I think getting out in the sunlight, and it's been vilified a lot over the years, but I think getting out in the sunlight is huge. If you can get out in the sunlight morning for about 10 minutes and go for a walk, you're getting some exercise too. But that morning sunlight is good for your eyes, it's good for your body, it's good for your skin. Maybe if you're not, we're coming up in the winter here now, so like it's not yet, so you can still put your feet in the grass. It's getting a little cold, but grounding, those types of
Yeah.
things. I do think anything you can do to clear your mind, journaling, meditation,
Yeah.
movement-based stuff, exercise, yoga, a lot of this stuff is free, right? I mean, you could do a lot of this stuff at home. Eat real food, no boxes or barcodes. It should have come from a mother, Mother Earth, or have a mother, I
Yeah.
mean, these are things we should be eating. So I guess that's the easiest, right? Lots of
Those are
water,
those are
your
some
body weight in
great
water.
tips at home to be holistic and what are some things that they're telling you that you should do, but you really shouldn't do?
Well, I mean, there's lots of drugs out there. The drug commercials, I think, are the first thing we should talk about. Like, we're the only
Yeah.
country that does it, right? We have, I think, 5%. I don't quote me on these numbers, but 5% of the world's population and consume 50% of the meds, somewhere around there. I mean, those numbers are not the same. We're trajectory of health is the lowest. We spend the most. I mean, these
Yeah.
are things like, I mean, we got to know that first and foremost, right? So the more drugs you take, the bigger the problems you're going to have. So it's none of this, no drug is fixing a problem. It's just covering a symptom.
You
And a symptom is a great thing. People understand that, like, why would you like a symptom? I'm like, well, it tells me something. It tells me how I can fix something that's going on underneath
yeah.
that. So if you can find the symptom, and that people don't, the one thing people don't understand is there's no such thing as an immediate cure, right?
Mm.
All you're doing is covering it up. There's nothing is immediate. I mean, even surgery comes with consequences. I mean, I'm the proponent of multiple surgeries. There's a consequence that comes with every surgery. So I'm just saying, like, you got to understand, like, it's chasing health. We need to chase health. It's that simple. We need to turn around, chase health, and then in the times that you need it, an intervention, a drug is not a bad thing, right?
Mhm.
Surgery is not a bad thing. We're going to need these things at times, but I'm just saying we need to turn around and start chasing health. So the biggest things that you need to stop doing is fighting symptoms without trying to get to the root cause. I mean, that's the biggest underlying message that I can just share with somebody.
You also I know we speak behind the scenes about functional nutritional health and like what's your take on diet foods and gluten-free stuff, just out of curiosity.
I think so. Diet foods, you're going to be in a situation where it's if it says diet on it, it's usually a chemical shitstorm and you shouldn't eat it.
Yeah.
I just that's simple. I again, you're going gluten free. A lot of gluten free stuff comes off as being healthy, but it's just filled with other stuff. I
Yeah.
think the ingredient list is the first thing you should start with. To say fat free, is a lot easier, and than saying it's loaded with a bunch of chemicals, right? But it's fat free because it's been loaded with a bunch of chemicals, right? So
Yep.
these are the things that I think about, like. You should say it should have four ingredients. I may just buy it because it says that. I don't even know if I want to eat it. I don't even know if I'm going to like it. But compared to any other box that's on the shelf, I'm grabbing the one that says made with three or four ingredients. Okay, well, let's see what that is, right? So that's number one. I would just avoid it. I mean,
Yeah.
why are we going to put things in our body that didn't exist 50, 60 years ago, right? I mean, the shelf stable stuff, this stuff has chemicals, things that they call it GRAS, GRAS, generally regarded as safe, and they just push these chemicals through that we're eating. These chemicals are hormone disruptors. We're at an all-time low for fertility in this country. So
Yeah.
there's so many things that you can go into with this that, like, just don't eat the shit. If it's got boxes or barcodes, stay away from it.
I love it, dude. And so if we're taking care of ourselves at home and holistically, eating from mother, when things do come up, the majority go, and we always say this in chiropractic, chiropractic first, drug second, surgery last. You kind of just outline that. But it seems to be the opposite in a lot of cases. And when people find you, they're like, I wish I knew this sooner. So when should they call you? When is it time to call in the expert Dr. John?
I mean, you can call me anytime and schedule a free consultation.
Yeah.
Like I'm cool with that, right?
Yeah.
I look at myself for the people who come and want to work with me and allow me to care for them as like a health concierge, right? Like I think like you go to a hotel, you say, I want to get a steak tonight. They're gonna be like, go here, don't go there.
Yeah.
I look at it as I'm going to have this surgery, I'm going to have this procedure, I'm waiting for this specialist. I'd say, okay, well, let's talk about that. What are the questions you're going to ask them when you get there? What things do you think you want? What things do you think you don't want? And these conversations I'd prefer to have with someone who's a patient of mine. It's not going to happen on a consultation, but we can at least find out if we can work together.
Yeah.
So, I mean, there's that. And there's always some answers I want to give so that you can at least take away some nuggets. So, I mean, a free consultation is the first place to start. So, I mean, anybody can do that. But I would say the people that I work with the most is there's a lot of gut health in this office. There's a lot of brain health
Mm.
because of my story with the brain injury. So I do a
Yeah.
lot of concussion stuff.
I
Migraine.
always say it's really important, man. Like you got to find the doctor who's gone through the same shit as you because
Yeah.
they've done the battle.
Yeah, yeah. So I would say that that's a good place to start. I think anyone who wants to chase health, I mean, if you want to stop fighting symptoms, stop sick of being sick,
Yeah.
it's one symptom, you take one thing, you feel better for a little bit, but do you really feel better? I just so many people that come here that tell me they don't have a headache, and then I do what I do. And I'm saying, and I look at their pictures and I have my things all lined up. I'm like, there's no way you don't have a headache. And I just have this feeling. I'm like, you have this headache, and I see it on their face. And then I do one thing, and then they're like, maybe I did have a headache. Is that your head's not supposed to feel like that? And these people
Yeah.
just live like that most of their life. And I'm like, are you kidding me? You're 40 years old. You didn't know that your head isn't supposed to feel like that? So
Wow.
there's some moms that have brought kids in and say their kid has headache. I go, I bet you they do. and then the kid can verify it. And I'm like, that
Yeah.
kid could be that 40-year-old patient I met last week or that 20-year-old I met 3 weeks ago. It's crazy how many people live with a headache. I just don't understand it.
So what should people expect from you in your approach and the next steps?
So, I mean, we start with a consult to see if we're a good fit. I want
Yep.
to let people know that like there's a system here. It's a process. I don't want to start a process and have it half fall off halfway and have the person only get like minimal results. I want to care for you. I want to care for you.
Yep.
So we have a process. So we like to lay that out. And then after that, what we will do is we were going to do thermal imaging. We want a detailed aspect of what's going on in your neck. We'll take pictures to look
What's
at the neck.
thermal imaging, just so I can dissect it for people who don't like what is that? What does that look like?
So it's just like a high-powered thermometer that's going to go up the back of your neck to follow a temperature swing. And
Okay.
that temperature is going to be indicative of the musculature that's going on underneath it.
There's good or bad temperature, I guess you could judgment wise, or is it,
I
yeah,
would say it's just a pattern, right? You have a
pattern?
pattern to your neck, and that
Okay.
pattern is going to be line up with the 3D picture I have of your neck.
Cool.
So we know if you come in and hit that pattern, we're going to adjust your neck that day. If you
Okay.
come in and it's reversed, I'm going to look at you and say you probably feel like crap, but it's a really good thing because you're changing.
Yep.
Right. So, and then we can track that once we get them on the table and we look at them from a structural perspective. We're looking at hips and shoulders and how we can move things, but we always don't want to disturb the head. So that's where this is the biggest thing in our office. And then from there, we always are going to take a baseline of how you feel. So a symptom survey.
Yep.
From there, we like to ask people where they want to take it nutritionally. But if I had my way, we would be doing DNA and we'd be doing blood analysis on everybody, because I think it's just a good way to track where you're headed in life. And, then we take that and say, well, it's an eat it or take it philosophy in this office. So you either eat the food that you need more of, or if you can't eat enough of it, we got supplements that are whole foods that we would recommend for that situation.
Beautiful. Man, you're passionate, you're fired up, you're helping Rochester, you're making it better, you're helping them not chase symptoms, you're helping them chase health. And it's a big, beautiful thing, man. I want to thank Dr. John Tverka for helping us out and joining us today. If you're in Rochester community, you're listening to this, and you don't want to chase symptoms anymore, and you want to chase health, you know the guy to go to. Thanks, Dr. John.
Thank you, sir. Appreciate you.